evening. My name is Tim Gibbs with Delaware Health Force and director of the Delaware Mini Medical School. I'm joined by my colleague, Christy Handley from the Sussex County Health Coalition. This is the second in the early fall 2024 Mini Medical School series that we're doing in partnership with Bayhealth. Here are our social media QR codes. And it occurs to me I should send these all in an email, plus the QR code for the Sussex County Health Coalition and their URL. So as you all heard last week, the Academy was founded in 1930. We restarted MiniMed actually in 2009. And it's been going strong ever since. The funding for MiniMed since the pandemic has come from the American Rescue Plan Act through the governor's office as part of a workforce development initiative. And one of the reasons that we're glad to see you here is that we hope that some, if not many of you, will be really jazzed by what you learn across the series and consider a career in healthcare. The partnerships, as I said, for this MiniMed are Delaware Health Force, Sussex County Health Coalition, and Bayhealth. In terms of attendance, you can attend as many of the MiniMed sessions as you would like. If you're going for a signed certificate, you need to attend all 6 sessions live, or email me if you miss one, and we'll allow one makeup where you watch the video after the fact. Let me know that you've watched it, and then I'll ask you a couple of questions. Other than that, we like to say that there are no quizzes, there are no tests, there are no papers. This is purely for you to learn. For any of the adults in the group, there's no continuing education credits available for Mini Medical School. If you're looking for that, I'm afraid we can't help you. Moving on, why do we do this? So I just said we want to interest some of you in coming into the healthcare profession, and that could be from public health to being a nurse, a physician, a dentist, health informatics, a physical therapist. It's a very large field. So we want to expose you middle, junior, and high school students, undergrad students, even grad students, to a range of topics, different types of providers, different degree types and whatnot in medicine. It's an opportunity for you to engage with the presenter in the Q&A. You can learn without talking with your own healthcare provider and maybe about to get a shot or get your leg casted or something like that. There's no pain involved in this, hopefully. Occasionally, some of the slides, as you all have seen, if you've been in previous sessions, can be a little bit overwhelming, but we always try to warn you up front. And for the presenters, it's an opportunity for them to tell about their journey to become a healthcare provider. I've talked and I sent you an email about the process to become a member of the Delaware Youth Medical Academy. You qualify after you've attended 3 series in a row, and then we do ask you to write what's called a reflection paper, and then we move from there. Whoops, and I just went flying ahead. Housekeeping tips, as you all know, this is a webinar, not a meeting, so you don't see each other. Please use the Q&A feature. I see 3 people have already used that. Thank you. We'll get to that shortly. Don't ask questions of a personal or a family nature. Privacy is a very important issue that those of us who are in healthcare uphold. All questions we will attempt to address, some by staff, others we will redirect to the presenter at the end of her presentation. You need to stay through the entire presentation, but when the presentation's done, you can leave. You don't have to stay for the Q&A part, although a lot of good stuff happens in Q&A. So this, whoops, next, I'm just jumping all over. This is the fall lineup. Last week we heard from Craig, and today we're going to hear from Constance, or Connie, AjahAyang. AjahAyang. I did it. Excellent. All righty, and at this point, I'm going to turn it over to Christy to do the introduction. Christy.
Great, thank you for having me again. As Tim mentioned, I'm with Sussex County Health Coalition, where we work to advance better quality of life for our Sussex Countyans, as well as Kent Countyans, and we are partnering with Tim and his group to bring this mini medical school to Kent and Sussex County, and we hope that you enjoy it. So today's speaker, we are excited to have Connie join us today. She is a clinical RN informatics nurse manager with Bayhealth Medical Center. As far as her education, she's board certified in nurse informatics. She has a master's degree in nursing informatics from Walden University. She manages, leads, coordinates a team of multidisciplinary members, ensuring optimization of EHR and other patient software applications. She has 15 years experience in nursing practice with 10 years in informatics and informatics analysts, 2 years in leadership, and she's been a staff nurse on medical, surgical, end-of-life oncology unit for 3 years. As a clinical coordinator for that same unit for 2 years. Her accomplishment, she's a published author of Nothing But Faith, Activating Your Spiritual Stethoscope, 3 times Delaware Top Nurse nominee for Nursing Informatics from 22 to 24, Nursing Excellent Team Award nominee for 2024 at Bayhealth, part of a monumental IT adoption and implementation at Bayhealth, which was their Epic EHR, which I remember when that was going through, remember when that was taking place, and new Sussex campus in 2019. Her specializations are IT adoption and implementation, supporting end users to become more apt in the use of EHR and data utilization, project management, workflow design and analysis, system support, and optimizing workflows to improve patient care, ease of use, and quality outcomes. And we would like to welcome Connie at this time.
All righty. Let me go ahead and stop sharing here. Okay, Connie, over to you.
All righty. Share my screen. All right. Can you all see my screen?
Yes, ma'am.
Yes.
All right, good. Good evening, everyone. Thank you again for having me. Thank you for the wonderful introduction, Christy. I'm so excited and I'm honored to be part of a team that inspires the next generation of healthcare in Delaware. So today, my presentation is going to be about, I know the topic is healthcare informatics, but I'm going to focus on nursing informatics. And I title my presentation, Informing the Future of Healthcare, Nursing Informatics 101, because that is my specialty. A little bit more about my background. If you were to tell a 14-year-old Connie that she would be a nurse, I would tell you that is a lie. Growing up, I immigrated to the United States 22 years ago from Cameroon, West Africa. Growing up, I had on the screen you can see a part of an article that was done by Bayhealth in 2022 in honor of Black History Month, and that summarizes my journey in healthcare and from back home. But in that article, I told my story of how I became a nurse, and I'm going to share that story here. Like I said, if you were to tell 14-year-old Connie growing up in Africa that she will be a nurse, I would tell you blatantly that is a lie. Why? Because growing up, I had an interest in politics. I was aware of the climate of politics in my country. And the love for politics is something I shared with my late dad. We used to listen to news, read articles, watch CNN. I was very interested in news and politics, the climate of politics. And one of those days, on one of those occasions, at the age of 14, my dad and I were listening to news, and there was an announcement over the radio. That was the radio, not even TV. And during that announcement, it talked about one of a conference that was being held, and it was about lawyers. Cameroon uses Commonwealth law, and so which is similar to Britain. So we have magistrate in Cameroon, and our high court system was organizing that conference. The president of the high court, when it was announced, was a lady. And I turned to my dad immediately and I asked my dad, so a lady can be the president of a high court? And he told me that, yes, you can be whatever you want to be. From that moment, I knew exactly what I wanted to be. I wanted to study law, and I wanted to be a magistrate or even a president of the high court in my country. So that journey took me through, I was in board, my parents grounded us in, they made sacrifices and they made sure that we're grounded and focused. They sent us to boarding school. I went to a Catholic boarding school, all girls Catholic boarding school throughout secondary and high school. And all my focus was that I was gonna study law when it's time to go to university. The twist of my story is that in high school, that lady, I met her in person and I told her this story, that you inspired me and I want to go to college to study law. She was so excited, saying that these are the kind of people that they want to hand over the country to. Just like I'm sharing this story today, and I hope it inspires somebody. It's just to tell you that it is not too early to know exactly what you want to be in future. So I took on that, I went on to college. We do advanced level certificate. I passed my advanced level certificate, applied to the university. Cameroon is a bilingual country. The French-speaking folks are a majority, and where I come from, the English-speaking folks, we are the minority. And we had just one English-speaking university at a time. I applied to that university like every other English-speaking young girl who wanted to go to the university. I intentionally, on my application, selected law, right? The first choice, second choice, and third choice, because I didn't want to give them a chance not to admit me into the Department of Law. But guess what? When I went to see the registrar, and I was told I was admitted into language arts, and I asked him, what do you want me to do with English language arts? I'm not putting down English language arts, but at that time, I already knew I had a passion for law. I studied so hard to go to the university so I can study law. And he was like, no, you're gonna be admitted to language arts. I remember telling him, thank God, the University of Boya is not the only university in Cameroon, and certainly not the only university in the world. Law it is, I must study. It doesn't matter where I have to go. So I decided to enroll into a French-speaking university in the Western province of Cameroon, where 70% of my studies were in French. It was a challenge. I struggled because I had to translate the lectures in French to be able to English, from French to English, to be able to understand and even take tests. But that did not stop me. And this is what I tell my kids too. If I didn't have a passion, or I didn't stay focused, I wouldn't have studied law. I would have said, well, they didn't take me in the law department. Let me just study language arts. But I knew exactly what I wanted to be. So to everyone listening, to the audience listening to me today, it is never too early to know exactly what you want. And if nursing or any field in healthcare is your passion, the key is staying focused and putting your eyes on the goal. So I completed my degree, though challenging, and I started my postgraduate, because to become a lawyer or a magistrate in Cameroon, you had to have a law degree, do a postgraduate education, and then go to the higher institute of magistracy. After that, you start practicing. You'll be sworn in and then you start practicing. But during that time, that 1 year that I was doing my postgraduate classes as course, I had my visa to immigrate to the United States. That was 2002. I've been here ever since. Coming to the US, I had my mindset I was going to continue law. However, I came and met a lot of mentors who geared me towards healthcare. And most of the reasoning that they gave me was that a field in healthcare offers stability in the job market. So coming from back home, I knew I had to do something to offer help to my parents. My siblings were all still back home. So I knew I had to do something that would give me a job so I can take care of my family back home. In me, I didn't think that I could do it, but I made up my mind that I was going to do it. So I started from the bottom up. I started from being a CNA, a certified nursing assistant, while going to school at Del State. And during that time, that is when an encounter with one of my patients changed my whole perspective on healthcare. And it brought out a certain humanity from within me that I never knew I had. So one of my I really love this lady. She had all going for her. But this was towards the end of her life, and her life ended up in this one room in a nursing home. On her pictures, you see she was a beauty contestant. Her husband was a military pilot. They used to fly the wall. And when I started taking care of her and build that connection with her, I decided if I'm going to do nursing, if I'm going to take care of patients, this is somebody who is letting a whole stranger like me into her world in her most vulnerable state. And I started thinking that could be me in that on the other side. That could be a family member of mine. So if I had to do this, I had to do this with compassion. I had to do this with care, like love for the job. And so my love for healthcare and nursing started to grow. Completed my nursing degree in 2008, and I was hired at Bayhealth. So I've been with Bayhealth ever since. I'm currently the manager for nursing informatics at Bayhealth, and I have been in nursing now for 16 years. I started in 2008. My clinical experience, I started as a bedside nurse on med-surg end-of-life oncology unit. I worked there for 6 years, and I went into informatics in 2014. When I decided to go back to school, I started having a family. I'm a mother of 2 boys. They're 12 and 10. So I decided I wanted to do something that would give me a more work-life balance. So I'm there for my kids more than spending all my time at work. And informatics came to mind. I always tell people that as much as I am an immigrant into the United States, I am an immigrant. I'm also an immigrant to technology because I never grew up with technology. In fact, I had my first email account just before I immigrated to the United States. That was way after college. So it was also new to me. But the thing that struck me, what pushed me into doing informatics was that during that time on our unit, the hospital was implementing a system called CPOE, computerized order provider order entry. And I decided to sign up as a super user. And that got me interested in what they were doing. So I don't know about anyone in the audience, but if you know about providers' handwriting, they're always hard to read. And this system allowed the providers to enter their orders in the system so we can act on them as nurses. So I decided to be a super user for my unit, and I was hooked because I began to understand how much technology can help ease the life of clinicians at the bedside. And I wanted to be part of it, the constant evolution of the use of technology in healthcare. So that's what made me got interested in informatics, and I enrolled in Walden University in 2013 to study a master's in nursing informatics. While I was still in school, an opportunity opened up in the department here in the nursing administration. I applied, and I have been there ever since. And as far as professional involvement is concerned, I am a member of the American Nurses Informatics Association, for Greater Delaware. We used to have a Delmarva as chapter, but it was dissolved recently, and we're all enrolled in the nearest chapter to us, and that is Greater Delaware, which includes Pennsylvania. So we're moving right along to the next part of our presentation. Today, our goals and objectives are going to be, at the end of our talk today, I hope our students will be able to define what healthcare informatics is, define nursing informatics, name 2 Institute of Medicine reports driving the need for informatics in healthcare, name and define the 4 metastructures of nursing informatics, state 1 reason why informatics is important, and describe 1 role assumed by an informatics nurse. So I'm going to ask a question. I know you're not able to answer, but if you're able to send your answer through the chat, that would be great. Has anyone heard of the word informatics before today? I get this question a lot, even meeting people in the hallway and like, what department do you work in? I'm a nurse informatics. Oh, what do you guys do? So many people ask us this question. So I'm going to start with just talking about what the word informatics is. So the word informatics comes from information. It's basically how information is being stored, how it's being processed, communicated, and how it is used. It is a science of information and mostly thought to be computerized information, but how information is handled, processed, communicated can be applied to any other form of information, such as on paper or audio. And that's why the main reason it is usually linked to a scientific reason, it is because it is more likely linked to computerized information. And hence we have healthcare informatics. So what is healthcare informatics? The American Medical Informatics Association defines it as a science and practice of acquiring, storing, retrieving, and using healthcare information to foster better healthcare and health outcomes. When you walk into a doctor's office or a clinic, we ask you, the nurse or the unit clerk that you meet, the first thing they ask you is your information. We store that information in the system. How that information is used is what informatics does. How that information is processed, how it is communicated, that is what informatics does. And this is a growing field. It uses technology to improve healthcare outcomes. And there are several subspecialties. One of them, nursing informatics, which is my focus, which is my area of specialty. There is clinical informatics, there's pharmacy informatics. So informatics is growing and it will continue to grow with different specialties, subspecialties under it. So what then is nursing informatics? What I'll tell you is that it is not using a computer. It is not just a nurse using a computer. The American Nurses Association defines informatics as a specialty that transforms data into needed information and leverages technologies to improve health and healthcare equity, safety, quality, and outcomes. As a nursing informatics, we support consumers, patients, nurses, and other providers in their decision-making in all roles and settings. This support is accomplished by using information structures, information processes, and information technology. Our goals, the goals of a NI is to improve the health of everyone at all levels, populations, communities, families, and individuals. Another goal for nursing informatics is optimize information management and communication. And that includes the use of information and technology in providing direct care, establishing effective administrative systems, managing and delivering education, supporting lifelong learning, supporting nursing research, and providing direct support to clinicians. At the center of nursing informatics is a conceptual framework. And that conceptual framework is made up of data, information, knowledge, and wisdom. So what is data? As you can see on my screen, I have some 3 numbers here, 72, 150, and 50. As a nurse, just looking at those numbers, I can't tell if those numbers are good or bad. So therefore, data are just numbers, they're characters. They're facts gathered, but they do not have an interpretation. There's no definition to it. Looking at those numbers, I'm not able to tell that those numbers are good or bad. However, it becomes information once it is interpreted. So 72 beats per minute is information. I know that's a heartbeat. 150 beats per minute, I know that is a heartbeat. So it is data that is interpreted and is organized in a structured form. 50 beats per minute, I know that is a heartbeat as a nurse. But what knowledge can I acquire from that? What does that tell me? Is it a heartbeat of a child? Is it a heartbeat of an athlete? Is it a heartbeat of an older person or an adult? Is the heartbeat even normal for that patient? So that's where information comes in. It's data that is synthesized, it's information that is synthesized to identify and formalize relationships. So knowledge, it becomes, it's written out as 32-year-old athlete with resting heart rate of 50. It is normal for a 32-year-old athlete to have a resting heart rate of 50. But it is not normal for a 39-week gestation pregnant woman. So once that knowledge is synthesized, it is applied in a practical way for something to be done, for action to be taken, and that becomes wisdom. I know that for a 39-year-old woman for a woman at 39 weeks gestation to have a heart rate of 50, that is not normal. So I'm going to act on it. So you're able to make the connection between data, and this brings us back to informatics. It is the managing, the storing, the processing of information. So data becomes information, information becomes knowledge, and wisdom is applied. When I understand that knowledge, I'm able to apply it to practical life experience, to practical things, to be able to solve solutions. So these are the core, this is the core conceptual framework that drives nursing informatics. Why do we need nursing informatics in healthcare? Well, how it all started. In the late 90s and early 2000s, the World Health Organization's ranking of healthcare systems ranked the US as the 37th healthcare system in the world. The ranking was 37. That was way behind so many other countries. The Institute of Medicine published a briefing in 2013 stating that the US spends so much money on its citizens for healthcare than any other country, but we do not have the best healthcare system. Later on in 2013, we were ranked the 17th in the world. And today, and also preventable medical errors were the 6th biggest killer in the US. Today, they are ranked at number 3. So this is why there was a call out for something to be done. I can tell you for a fact that no nurse, no doctor walks into the hospital to do their job and they intentionally say, I want to go and cause a medical error or cause harm to a patient. That is not what we do. But the systems could be things that we could fix so that these errors do not happen. And that is why, as a result of all that was happening in healthcare in America, the ranking and all the medical errors, the Institute of Medicine wrote a report in 1999, and it titled it, "To Err is Human, Building a Safer Health System." That report called out that 44,000 to 98,000 deaths occur annually related to medical errors that are preventable. And as a result of that, it outlined a four-tier approach to achieving a better health safety record in the US. And this was the basis for the next important work to be done. Mind you, it was not saying that doctors or nurses are bad. They intentionally cause harm to people, to the patients. No, it was saying that the system that they work in needs work, needs to be improved for better healthcare to be provided to our populations and communities. So that is what is called out. And this was the basis of the next work to be done in the field of informatics. In 2001, they came up with another report, Crossing the Quality Chasm. It's a new health system for the 21st century. This called for the reinvention of healthcare system in the US. And it had 6 aims for improvement. 1, that healthcare must be safe. It has to be effective. Providing healthcare should be patient-centered, that the patients should be at the center of making their healthcare decisions. It should be timely. Healthcare should be efficient and equitable. And the rules for that design were knowledge has to be shared and information should flow freely across the system. That decision-making should be based on evidence, research, and safety should be a system property. And most importantly, there should be transparency for information on safety performance, evidence-based practice, and patient satisfaction. As a result of these reports, there was a summit, a health professions education summit in 2002, and it was titled A Bridge to Quality. From that summit, they come up with 5 competencies for healthcare education. And it was provide patient-centered care, work in interdisciplinary teams, and plus evidence-based practice in healthcare, apply quality improvement, and utilize informatics. This all resulted in educational reform that called for and recommended nursing informatics integration into nursing programs. When I was at Del State, I never had a course in nursing informatics, but today, I can tell you so many, I've done a lot of interviews from nursing students wanting to know, because they have a course in nursing informatics now, they do interviews and write papers about our role, and I've helped so many students in doing that. But in 2008, we never had that, but that's when this reform started. It called for to prepare the next generation of nurses to practice in a world of technology. It called for a reform in our nursing programs and nursing education to integrate informatics into the nursing program as a course. And that is happening today. So what does the career in nursing look like, in nursing informatics look like? The path starts with, you have to have your nursing degree, a BSN in nursing, obtain your registered nurse license, gain clinical work experience. The clinical work experience is very important because in our role, we are kind of connecting technology to practice, right? And I cannot do that without having a background in nursing or in a clinical field. Just like pharmacy informatics, you have to have a pharmacy degree to be able to help your colleagues in bridging the gap between technology and clinical practice. So it's very important that you gain clinical experience. And also develop and advance your key skills and obtain relevant certifications. I obtained my certification in nursing informatics, so I'm board certified. It gives you leverage in career, in advancing your career. And those skills that are important is clear communication, collaboration, because we work with multidisciplinary teams to make things happen, to change, to implement changes constantly. You have to have project management skills. We are constantly working on projects. I cannot tell you on a certain day that I know what I'm going to do when I come to work that day. But you should be able to manage and prioritize your work on a day-to-day basis. So those are skills that are important to strive in a nursing informatics field. The nursing informatics specialty has, like I said, you must be trained, but it has two core roles. You must be trained as a nurse, a registered nurse to work in the role of nursing informatics. But there are two main roles that you are entitled to. There's a nurse, informatics nurse generalist. This is just a nurse who is interested in technology, has experience or has interest. Like I said, I started as a super user. So if I didn't get a formal education in master's, with a master's in nursing informatics, I'll be an informatics nurse generalist because I am a registered nurse, but I have interest in that area. And a nurse informatics specialist, which is what I am, is someone with an advanced graduate degree, either a master's or a doctorate, and they're usually certified, which is what I have. And you can also become an informatics nurse consultant. And in that role, you're consulting as an expert, helping organizations implement IT solutions that help to improve patient care. This is a growing field and it continues to grow, especially with the evolution of technology and the use of technology in our space. So the role of nursing informatics nurses, like I said, many people do not still understand what we do. I still meet people on hallways, and when I tell them I'm an informatics nurse, they're like, what do you do? The short of it is this: I am a middleman, a go-to person, like a liaison between our nurses or clinicians and the IT folks. So it is often said that a nurse informatics is bilingual because we speak nursing and we speak IT. Our IT counterparts, they understand technology, they know how to build things and put things together, but they do not have the clinical expertise to put things together that work for our nurses and our patients. That is where we come in. We work with our nurses to identify issues, or they identify issues and they come to us and, hey, Connie, this system is not working right. Could we do better? We design a workflow and we tell the IT folks, this is what works best for our nurses, because at the end of the day, we want technology to work for us and not the other way around. So our role is vast. It could be, we work with multidisciplinary teams across healthcare systems, interacting with key stakeholders on a daily basis. And we are there to connect patient care to technology and to drive better patient care and outcomes. And common practice areas include management, administration, leadership, clinical informatics area, data management and analytics, patient safety and quality, research and evaluation, compliance and integrity management, coordination, consultation, facilitation, and integration. So there's so many roles. I have a video to show you on what this nursing informatics look like, a short video. And I'm gonna play it in the next slide. Oh, something is wrong with my volume here. Can you guys hear it?
No, we can't.
Okay. Let's see.
I believe that if you go to the microphone icon
On the Zoom, okay.
and go to audio settings, it might be there. Christy, do you know offhand?
I'm looking.
I need to.
Sorry, class, technical difficulties.
As always, even an informatics person will have technical difficulties. All right, let me see.
Nah,
Mhm.
got a lot of feedback now. Connie, whatever you did, that's causing a lot of feedback now.
How about now?
You're
I hear
better.
you. Mhm.
Oh, hmm.
Connie, on the share button that you have right now, do you have a place that says share sound?
Oh, okay, let me see. I don't see a share sound.
No.
Hmm.
Well, unfortunately, I recommend that you continue on.
Okay. I hope when you share this the presentation, they'll be able to play it on their own. It played today for me, but I'm not able to play it now. I'm so sorry about that. Okay. So that video was a summary of what we do in informatics and what it's all about. All right. So the benefits of nursing informatics in healthcare. So most often the time spent by nurses taking care of patients is very costly. What nursing informatics does is to help improve how data and information is handled to make it easier for nursing to provide quality and efficient care more effectively. Other benefits for nursing informatics include improving the health care of our patients, the patient health outcomes. Oh my God. Sorry. Health outcomes of our patients, enhancing patient safety. And how do we do that? We do that by reducing medication errors, improve documentation of the nurses, enhance surveillance and monitoring of our patients. We also help with increasing efficiency and productivity by streamlining workflows, reducing paperwork, improved communication and collaboration amongst teams, and also in better decision-making, using data to drive insight, to drive the nurses' work. Evidence-based practice, informed policy and planning. An example on how we use data to drive the work of nurses is like, say we are trying to find out why there's a long wait in our ERs, right? Why is it happening? We are gonna go in and analyze the data, looking at from when the patient walks in to when that patient is seen. What are the circumstances surrounding that wait? Why would a patient be waiting? And what are the time frames? Is it during the day that the wait time is long? Is it that we don't have enough staffing during that time of the day? So that's how we analyze this data to drive insight and make better solutions and provide better solutions to for our nurses to better take care of our patients and also have better outcomes. So that's one of the ways that we use data to drive care. What are the future directions and trends in healthcare? I know many of us have heard of artificial intelligence. So it is becoming very popular today. How does it impact clinicians in providing care? So these are the things that we have to consider as we continue to evolve in informatics. How can we leverage the AI technology to better outcomes for our patients? So these are the things that we are looking at. And at Bayhealth, we have started looking at it too. We have a team of experts looking at how AI can be implemented. There's several ways we can do that. We can look at how it can reduce the burden of documentation for the staff at the bedside. We can use it to alert them ahead of time, set certain reminders in the system for the work that they do. So there's several things, and these are exciting times in healthcare. As technology evolves, so does healthcare. So infusing technology in healthcare is rather very interesting and exciting at the same time. We also have things like Internet of Things, and these are like smart devices that collect data and share information in a network. An example is a smartwatch. So many of us carry smartwatches around. They tell you how many steps you've taken in a day. They read your heart rate. How does this impact care in the hospitals? An example, a patient's monitoring device for blood glucose. They have their personal monitoring device that stores that data. And when they come to the hospital, how do we integrate that into individualizing their care? So these are the things that we are trying to consider as technology continues to evolve. There is machine learning and their potential impact on healthcare delivery. And other applications that are coming, we have predictive analytics, personalized medicine, virtual nursing assistants, robotics, etc. So there's so much that we can do in healthcare with technology. It looks like I skipped a slide. Did I? I'm sorry, I didn't talk about the applications in nursing informatics. So there are several applications that we use in nursing informatics. I'm sorry, I have to take you guys back because this is also important. It's the electronic health records. Electronic health records back in 2010, when the healthcare, popularly known as Obama Healthcare, was passed, it encouraged organizations, actually doctors' offices and clinicians, to implement electronic health records. And this is translating your paper chart when you come to the hospital into the computer, into a system. And this allows for information to flow easily. Once this is implemented correctly, a patient can travel to, say, California from Delaware, and if they fall sick and they go to the hospital, that hospital is able to see everything about that patient because these systems are connected, because we have all your information in an electronic system. So, and the benefits for it is improved accuracy, accessibility, and coordination of care. There are actually certain challenges when it comes to EHRs. It's like data privacy, interoperability, like the movement of a patient from the ER to OR and back to inpatient. We need to have that information flow seamlessly so that we are ready to take care of that patient. Care coordination is made easy, but sometimes it is not that easy. There are standalone systems, and that causes challenges in delivering care. There's telehealth and remote monitoring. When I was in school for nursing informatics, we learned about telehealth, but I never saw it in practice until 2020. And this allows, when the pandemic hit, right? So you could stay at home and have a visit with your provider through video conferencing. That is happening today. It is evolving to a point where we are looking at virtual nursing, right? If we can visit with a provider through video conferencing, then we can as well connect with a patient at the bedside, especially to augment the shortages of healthcare professionals and nurses in particular. We can use technology to bridge the gap and augment that staff shortages and also release nurses at the bedside of the workload. Of course, there'll be challenges with that. It's technical issues like we just had here now. I couldn't play my video. Regulatory frameworks and reimbursement also could pose a challenge to implementing these processes. And then there is a clinical decision support system. These are software or algorithms that we build in the system to provide healthcare professionals with clinical guidelines. It helps to improve diagnosis, it helps with treatment and patient outcomes. Challenges is that some of the challenges that we face is the data quality, because the computer is a computer, it's a thing. Once you put in, there's a saying that you put in garbage, you get garbage out. So it is very important that the information that we store in the system is accurate, is timely, and can be easily assessed. So if your data quality is not good, then the information in your system might as well be not used. So it is very important that we pay attention to the data, the information that we put in the system. And of course, there's data analytics, all that data. Somebody needs to be looking at it, examining it, analyzing it, digesting it, and getting insights from it to better take care of our patients and make better healthcare decisions so that there is improved patient outcomes. So that is the slide that I skipped, and I'm sorry again about that. We've talked about the benefits, the future trends, and my conclusion. I'm calling on the audience. This is a call to action, and I have a quote here that says, "Nursing informatics is essential for the delivery of high-quality patient care in the 21st century, as it provides nurses with the tools and knowledge to make informed decisions, improve patient outcomes, and transform healthcare as a whole." So whatever field you choose to specialize in, your clinical background, and you're interested, if this presentation sparked your interest in informatics, know that you are needed. You would be needed for the future of our healthcare. And the job market is growing. According to the US Bureau of Labor Statistics, the employment for registered nurses in every role and specialty, including nursing informatics, is expected to climb up to 6% between 2022 and 2032. So the demand for healthcare professionals continues to increase, and professionals with a knack for technology and vested interest in technology will even be in higher demand. This brings me to the end of my presentation.
All righty. Thank you very much. I think that I may have solved the question about the sharing. If you go back to share screen again,
Okay.
when you click on it and select the window, there might be another place where you can say share sound within that
Okay.
window. Do you see that?
Select a window.
So you're selecting the window of your PowerPoint presentation, and then do you see somewhere within that share box, share sound?
I have here basic, advanced files, and I don't see a select a window. Yes. I don't see a share sound.
Okay, all right. It was a thought. When you
Oh yeah, I see that. I see that now.
all right, why don't you go ahead,
Okay, let me go back
click
to the
share
slide.
sound, and then go back to that slide.
Yeah. Okay. Select the window. Okay. Two. Share sound, share.
Using technologies, we can really deliver better.
It's working.
Using technologies, we can really deliver better patient care. We can connect clinical experts and technical experts to develop better product. Our students are very passionate about using technology to drive changes in clinical practice, and they can really transform our healthcare arena.
I was a bedside nurse for 10 years. While I was doing that role, I was also a member of the Nursing Informatics Committee, and I felt like I could really make a difference going into informatics.
As a nurse manager, I got to see firsthand the frustration of our clinician using the system and felt that I could make a real impact in system implementation by system analysis, better workflow, better design.
As a nurse on the floor, I could see from the user side of things what it was like with all the new technology and software being implemented. And sometimes it was handled well, and other times it was tougher.
They know the clinical workflows, and they understand what our patients need, and they understand clinicians' need. At the same time, the nursing informaticians can translate those aspects into the terms that clinical experts can apply to develop better systems.
I feel like I can still really help the patients as well as the clinicians on the floor in terms of better patient safety, maybe even more efficient workflows for the clinicians.
What I look for in a new hire into the clinical application team, I look for someone that has clinical experience, operations experience, but also a system analysis or analytical background, and someone who has the passion to really do the right thing to provide the best quality care to our patients. And if they always keep that in mind, I think we always have better outcomes in our system development and design and workflow and processes.
Our students can go and do really great things, but yet their identity are still nurses. The formal, rigorous graduate level education can prepare our nursing informaticians to become leaders, and they really drive the changes in healthcare.
I find the role in informatics to be very fulfilling. Before, as a nurse on the floor, I would only be able to work with a couple of patients at a time. But right now, I am able to affect the patient care as well as the clinician experience in a positive way for an entire medical system.
All right, that video was from the University of Maryland, School of Nursing, and I have met one of the professor on that screen. I met her at a conference at one of the nursing informatics conference in Maryland a few years ago. She's one of those pioneers driving informatics in academia.
Okay, all right, so we have questions. First one, with informatics, is there an expectation to better carry a patient medication list forward from the ED to admission to care plan without the patient having to reconfirm multiple times? Is there a tipping point with the number of medications?
So if I understand the question is the multiple times that we ask those questions when a patient comes into the ED and they have their medicines from home, right? We ask them, we do that intake in the ED, and at the same time they come to the floor, we ask those questions. The reason behind this workflow is that, and I understand sometimes it's frustrating to the patient, especially when they're not feeling well and you keep asking them these questions. The expectation is that in the ED, the nurse in your triage is able to, they are an emergency system. They're able to ask those questions so that they can administer medications that are not that may not cause, so that medications that they will administer to you may not cause interactions with the medications that you're taking from home. But when you come into the floor, we are able to have more time to go into details on your not only your list of medications, but the dosage and stuff like that. We don't want anything to be missed. So that's why we ask the questions many times. And I have gotten those complaints before where patients said, oh, they just asked me these questions in the ED. Why do you have to ask me again? Sometimes the information that they collect might not be true and might not be correct. And we want to make sure that the information that we put in the system is actually what is right and is correct for the patient. I don't know if I answered that question correctly.
All righty. Next question. With telemedicine, how do you get past the fact that the clinician does not have the ability to take the patient's vitals directly?
Well, it's hard for you to take unless with technology. And today we have virtual blood pressure cuffs that you can do. There's some places that use that, but some systems are hesitant to implement that because you want somebody to be able to touch you, to feel, and then to be able to take that. But if they're comfortable enough, you can use virtual blood pressure cuffs. So there is a possibility of using virtual blood pressure cuff to take it, but it's not just widely implemented today. It's one of the things that continues to evolve.
Okay, now, if you, Connie, would click on, do you see the Q&A button that has a red 5 next to it?
Yes.
If you would go ahead and click on that, you'll be able to see the questions there directly rather than me reading them to you.
Sure. I see, I don't know which one was, okay, let me start from here. I see one, I'm gonna read it. Do you as an RN and informatics specialist feel that you still have a good patient connection, or is it more technical? I get this question a lot. So as a bedside nurse, when I was working as a bedside nurse, the impact that I had was with my 4 patients or 6 patients that were assigned to me. But as an informatics nurse, I might not have the direct patient connection, but the impact that I have on the patient, the impact that I have in care delivery impacts more patients, all patients in the system. And not only that, I'm able to help our clinicians work better. So my impact is felt in a system-wide role, as opposed to just caring for my 5 patients. So that's the connection that I still have with my patients. I want to make sure that if you're administering medications at bedside, you're able to scan that information, you're able to scan the patient, scan the medication, and it's correct in the system, in the order that we place in the system. So the impact that I have is more broad, and that gives me peace.
Okay, do you want to go on to the next question?
Yes, it says, what classes were needed to graduate college? Did you take chemistry, biology? Yes and no. In nursing, there is a chemistry course. There's an advanced biology, which is AMP. And so we did those courses in nursing. But in informatics itself, nothing like that. So you're still able to take science classes. Is there suggestions for nursing informatics in the pediatric field? As a pediatrician, because we have medical doctors who are informatics specialists too. So yes, you're able to do that. Even if you did you are a pediatrician and you want to venture into informatics, of course you can do that. A CMIO in the hospital is a medical doctor. And he's the chief informatics medical officer. If you were to go into informatics, how many years of education would it take? So after you graduate high school, college, your first 4 years of college is a nursing degree, just like any other degree, and 2 years of graduate school. That's the path for informatics. How many years of study would it take before being able to have a job in health informatics field? Similar to what I just said, so you need a clinical background and an informatics degree. So it's like 6 years. And like I said, the field is growing. It's always good to do your research to find where those jobs are. They're in health system. You can even be a consultant for a vendor. So most of the technology that we use in hospitals, we contract with vendors. And as an informatics nurse, you can work with them because you have the clinical background and you help bring those, you can work with Philips, vendors like Philips. We use their monitors for telemonitoring. So you can work with any vendor that provides technology software or hardware into the system. You can become a consultant for that company. So there's so many avenues where you can find a job. The next question is, when a patient is discharged from the hospital, there should be a way to automatically forward the information to the patient's doctor about their hospitalization. That is correct. So it depends on the HR that the hospital uses. At Bayhealth, we use Epic EHR. Most of the doctors do not have Epic, but there's something called Epic Everywhere that they're able to find that information when you leave the doctor. Like my kids, their doctors are from Nemours. I have a way of getting that information right away. If they come to the ED, their doctors call me. If I bring them to the ED, the next day the doctors call me, oh, you took your kid to the ED. How did they know that? I didn't call them that I was in the emergency room, but they found out that information because there's a way that they can tell because the systems are connected. So absolutely, that information flows to your doctor's office. Would you say you have to do more work now compared to when you had to be a nurse? Hard work, no, but work that requires my mind thinking out the box is what I do mostly. The workload is small, but it's not on it doesn't strain me as opposed to taking care of patients at the bedside. Now is I have to think out of the box to provide solutions. Like I said, on a day-to-day basis, I don't know what I have to do when I come in. There are emails, there are calls. Hey, this doesn't work. Can you fix it? So I have to connect with IT to make sure that happens. So it depends on what you call hard work, but I wouldn't say it's hard work. It's more intellectual work. Should you take advanced practice chemistry or advanced biology for nursing? I don't think so. I don't think that's required to be able to do nursing. So are informatics eventually going to be connection between patient and nursing providers? That will be accurate patient history. Is that what will improve information flow and accuracy? Yes, you should be able to take accurate information when the patient comes in. That initial intake that you're taking, that you're getting information from the patient should be accurate, and documentation should flow. That helps improve patient care, because the provider already knows that when they open the patient's chart, they're able to tell why the patient came in, because that information is taken accurately. We have to make sure that the documentation aligns with nursing documentation guidelines, and regulatory guidelines. Making sure that the data labeling that is the same across the board, that if I document a BP means a BP across the board. There is no shortcuts and stuff like that in the system. That is so the data that we collect and store in the system should be accurate all the time, because it's standardized data. Would you have to work as a nurse like bedside before working as an NI? Absolutely. You need your bedside clinical experience in any specialty, whether it's med-surg, whether it's critical care, whether it's emergency room. So all that prepares you to be a better informatics nurse, because you bring with you, like I said before, IT, you work with IT all the time, and they don't know the clinic, they don't have a clinical background in nursing. So that is where your expertise come in. That is where you shine, because you're able to tell them exactly what the nurses need, because that is what you know.
All right.
Is it hard? We have another one that is it hard to get a job in informatics field if you don't come from a great college? It doesn't matter what college you come from. Is just like I said, the jobs are out there. It's not hard to get it. Since being in this role in the last 2 years, I have precepted about 5 students who completed their masters in nursing informatics. So it is a growing field. People are learning of it now, and it keeps growing. And of course, like I said, we continue to use technology in healthcare, and as technology evolves, so there will always be need for people who have expertise in connecting technology and healthcare delivery.
All righty, I think that's all of the questions. I want to share my screen for just a second here.
Okay.
All righty. For those of you who have been asking, if you missed a session, you're going to go to DelawareMiniMed.org. Last week's session, which was on cardiology, you click and you watch the presentation video, watch the whole video, then email me, and I'll ask you a couple of questions based on the content of the presentation. In a couple of days, this evening's presentation will show up here under Health Informatics, and Connie's going to send on her presentation as well. And we'll make sure that when we convert it to a PDF, but there will be an active link so you can listen to that video. Next week on September the 25th, we'll be talking about anesthesia with Kimberly Westra. Have a great evening, everybody. See you next week. Take care.
Thank you.